talking to a male patient who maybe, as we needs skincare, but can be very hesitant because of, societal pressure or the way they grew up and how their, father figure acted and dealt with their own skin. How do you just talk us through how you talk to somebody like that? As you said, you kind of have to start with the basics, but how do you say, it's time for you to start really taking care of your skin?
Well, most of these patients are in your office for one reason or another. So
Mm-hmm.
you have a captive audience, and it's all about tying it to what brought them in. And if that
Okay.
concern isn't necessarily brought them in, maybe they're in the office for skin cancer or precancers. And, you can use that as an opportunity to talk about how they can improve their overall skin health so that they can decrease the risk of these skin cancers. You can, a lot of times they'll come with their wives and they're kind of in the back and they're a little
Mm.
bit shy about it, and we can break that down. Again, I tell them, I meet them where they are. I'm not going to give them more than they are capable of handling. And even with this very basic 3-step regimen, the Holy Trinity, I call it, sometimes we will start with one thing at a time, because 3 products can be overwhelming to somebody who's never thought about this before. And that can also put them in the position of thinking that maybe it's not really right for them. I'm glad that a lot of the companies are now designing their products in packaging that is a little more gender neutral,
Yeah.
so that that's not an additional societal pressure on the patient to not want this particular product on their shelf just because of the way that it looks. So we've gotten some help from different aspects of the industry, social media, the marketing companies. They're actually going after men now and trying to meet them where they are. So it's all about the trust in the patient and the relationship that you have and just allowing them to open up. But again, always go really slowly and try to get those clues from them so you can meet them where they are.
Mm-hmm. Dr. Keaney, any other pearls of wisdom here?
Yeah, I mean, I try to get a gauge with any of my male patients what their main concern is. I think Corey mentioned that. Is it, skin health, like skin cancer? Is it more of a medical, like, what can we do to keep my skin healthy moving forward? And then I will kind of go down the science. I tend to be very scientific and nerdy. And I think sometimes men appreciate that rather than be like, this is great, this is going to make your skin look amazing. I'm like, look, you're at high
Mm-hmm.
risk of skin cancer. Men don't respond to skin cancer, to UV light as well. So we need to do antioxidant sunscreen. And maybe I'll start there, like Corey, if the guy's never used anything. So that's 2. And if I have more aesthetically inclined gentleman who's like coming in for, hair loss, and he wants to talk about lasers and whatnot, then I'll kind of give him the kind of the 3-step program, the retinol, the moisturizer, the antioxidant, and often a sunscreen, and start there. And then as I develop that relationship and see how they're adapting to that skincare regimen, then I can kind of increase the complexity of the products and see how you go. And you'd be surprised. Some guys who are like never used anything, they love it, and they want to, all right, what's next? I want to add. And some guys are very aesthetically inclined. They're doing a million procedures, but they're like, no, I can only do 1 or 2 products max. And you
Yeah.
have to adapt.